I'm glad you're here. We're going to be talking about suicide, substance use, and adverse childhood experiences and how they intermingle with one another. Of course, mental health issues are obviously included in that because we know that people who struggle with mental health issues often struggle with substance use issues, and people with substance use disorders often, and at a high rate, struggle with mental health disorders. And so they work hand in hand together. And so we're going to look at what the nature of suicide and drug overdose looks like. So suicide is the 11th leading cause of death and has claimed the lives of over 500,000 people. And that's 2019 rates. Okay? Now there was a decline for a little while, but these are the most recent numbers that I could find through CDC and national websites. So drug overdose has been an epidemic, and it's long-standing. It's really a health crisis. And we know that with the drugs that are being used and that are coming into the country that have much more toxicity and higher levels of death associated with them, especially in the opioid and fentanyl area, with people using those types of chemicals causing lots of higher death rates. So alcohol misuse is associated with 94% increase in the risk of death by suicide. Makes sense. Does that mean that this is talking about people with alcohol substance use disorders? Not necessarily. But alcohol use comes into play when you have people who are thinking about suicide. Many have alcohol use disorder, but other people with mental health issues, if they have suicidality, if they're thinking about suicide, and let's face it, mental health issues, substance use issues contribute to suicide ideation. But if you really think about it, the number one thing that leads people to suicide is hopelessness. Hopelessness. And when you struggle with a mental health issue or alcohol and drug issue, and the struggle is long-standing, and you've worked with your mental health providers, you've worked with medications, you've gone to treatment multiple times over and over again, and the effects of the inability to cope or the way your mental health or alcohol use or drug use impacts your coping skills and ability to interact with the community around you and interact with your family and the family problems that it causes. And if you're the one who's suffering, you look around and not only do you experience the impact of those symptoms within you, you look around and you see the effect it has on those family members. And you see what you interpret as the burden in their eyes, when it may not be burden. For them, they feel almost as powerless as you do to be able to help. And they do their best, but if you view it from your cognitive perspective that you are a burden and that everything you've tried hasn't worked, you get to the point you just don't see hope. And suicide becomes an attainable relief and solution for all of that. And without hope, it begins to make sense in your head that if you exist no longer, you'll be out of pain, your family will be out of pain, and your friends will be out of pain. And it becomes a solution that can quickly be believed in as the solution. And if you're already thinking that way, and you're high on a drug, or you're influenced by drinking too much alcohol, and your inhibitions are lowered, then the impulse control is gone. You are much more likely to act on the thoughts you've had. And that creates a scenario that is hard to overcome. Not only for you, but for family members, for mental health practitioners. How many mental health practitioners in here have not been touched by the loss of a client or patient by suicide, or alcohol and drug provider? How many have not been touched at some point in your career? And when you were doing the best and everything you could do, how many family members who've been touched did all you knew how? But you add those components together and it becomes almost overwhelming. And we can actually, if we allow ourselves to go, wow, maybe that is hopeless. But we know better. As mental health professionals, we won't lose hope. And our role is to provide hope in any avenue we can, to provide the treatment needed to help prevent suicide. So when you think about alcohol use and how it worsens loneliness, how it worsens depression, how it lowers those inhibitions, it makes sense that it contributes to people acting on those thoughts. The more heavily and habitually someone drinks, though, the more vulnerable they are to death by suicide because of the things that I was talking about, the compounding effects of what constant substance use disorder has upon a person and the people in their lives. Now, women's risk for death by suicide is particularly affected by heavy and prolonged drinking. Why would you think women are more affected by that? Anybody have an idea? So you have to yell it out. I don't like to just talk, I like to ask questions. Say it again. They may not metabolize alcohol as well as men, right? So it has a quicker effect on them as well. Any other variables that you might think may cause women to be more vulnerable? Trauma, right? Sexual abuse and trauma histories may come into play to that because they may have a higher rate of those kind of traumas in their lives. What about economic factors? Okay, you have, so some economic factors may affect single moms or low-income mothers as well may have an effect because we're going to look at those childhood ACEs that have that contributing factor as well that may affect women a little bit more than men. So almost all substance use disorders are associated with an increase in that suicide risk. And research shows that the hazards ratios is a ratio of 1.35% for cocaine users. It's more of a hazard for them. 2.10 for psychostimulant use, people using amphetamines, things that speed your body up. 3.83% for benzodiazepine use, and 3.89 for cannabis use. How many people believe that cannabis is a harmless drug? There's nobody raising their hand in here? Oh, no one's being honest in here, right? No, but isn't that the myth out there that cannabis is the least harmful substance out there? And its main danger is that it's a gateway drug. But the reality is the cannabis that's available today is very, very strong and very, very powerful and has strong effects on people's minds. And it rates higher than benzodiazepines for suicide ratios. And benzodiazepines can actually, be accidental suicides or accidental overdose because of the nature of that chemical on the body and how it can stop your body from just, your heart drops your ability to breathe or your body's mind that tells you it's time to breathe. So 11.36 for sedative use. So again, more sedatives, something that's going to put you to sleep or something that's going to lower your brain functioning has a higher rate of ratio for suicides. So all of them were independently related to suicide, even after you control for socio-demographic factors. So every drug that we talk about, anybody has a habitual use of chemicals or substances have a higher risk to get into the area where they're going to have suicidal thoughts and or attempts. So tobacco use and smoking appear to contribute to death by suicide. Smokers are at the high risk of suicidal ideation, plans, and attempts, followed by past smokers, with non-smokers carrying the lowest risk. So genetic vulnerability in the serotogenic system may predispose a smoker to suicide, although the exact mechanisms have not been validated yet. So that's an interesting thing to know about smoking, that if you smoke or vape, you have a higher risk of suicide. That alone, and that's not combined with other chemicals. Any ideas other than that brain effect? What else? When you're without nicotine, you're crappy, right? Yeah, but think about the effects of nicotine on the brain. They're saying there's kind of a predisposition that if you're willing to smoke cigarettes and take that risk, you might also be a larger risk taker. And risk takers may get into behaviors or coping skills that might lead to negative results in their lives. So it might be contributing to more suicide ideation or thought. So opiates and suicide. Adults who receive high doses of opioids are obviously at an increased risk for suicide. If they use it weekly or more, they're more likely to engage in suicide planning and attempts. Adults who have opioid use disorder are 13 times more likely to die by suicide than the general population. That makes sense because opiates are much more lethal than a lot of other chemicals. Now, higher doses of opiates offer increased access to lethal manners or lethal means. So if you're going to commit suicide and you're already using opiates, you have that lethal mean readily available to you when you have that impulsive or that thought to go ahead and follow through with your plans. They have disinhibiting effects, again, increasing the likelihood that you're going to not be inhibited by the fear of what will happen if you attempt suicide. People who take higher opioid doses share characteristics that explain the link to suicide. Obviously, they have mental health issues, they've had multiple hospitalizations, the hopelessness, they have physical problems, they have financial problems, they may have had a bunch of the adverse childhood experiences in their lives. Prior trauma will affect people's suicidal ideality. And again, if you're combining that with a chemical that's very easy to use to overdose with, then you're going to have a higher rate of suicide. Now, the problem about tracking opiates and suicide is, there's a lot of overdoses. It's hard to determine. EMS and other medical professionals can't always determine if that overdose was a suicide or was it accidental. And unless the person left a note or was talking about suicide ahead of time or was talking to close family members or friends, then it's hard to determine a lot of times what an accidental overdose may have actually been a suicide. And so the numbers aren't that accurate all the time. So adverse childhood experiences is what we're really learning to find that how it really affects people's mental health as well as their tendency to use substances. And so it's really important. I'm on the Children's Trust Board, which is a state board that works for the prevention of child abuse, and really working to reduce the number of ACEs that children go through. And so these ACEs are some of the areas that are targeted in order to help families actually prevent child abuse. This is the goal there is not to treat post-child abuse, is to actually create prevention strategies to help those families ahead of time so child abuse doesn't happen and these ACEs do not occur. So the traumatic events that occur in childhood, anywhere between 0 and 17 years old, they include child neglect, experiencing or witnessing violence, parental substance abuse, experiencing bullying, racism, or having a family member attempt or die by suicide. So these are some of the things that contribute to traumatic experiences in childhood. Now, what do we know about trauma? All right, for people to be diagnosed with post-traumatic stress disorder, the first thing that has to happen is they have to be exposed to or confronted with their own potential death or exposed to a loved one's potential death. And that's one of the first criteria. of trauma. But the reality is trauma is seen in the eyes of the beholder. Because if I just threw out a bunch of large tarantulas into this room, some of you would be traumatized, right? If I threw some small spiders that aren't dangerous, some of you would be traumatized, even though you know you wouldn't die. But the effect that it would have on you, so trauma happens in a lot of different ways. And so, trauma symptoms may not meet the criteria of post-traumatic stress, but having trauma symptoms that you're holding on to throughout your life can affect, obviously, decisions to use or not use substances as a coping skill, or can affect your mental health overall. So included in aspects of child's environment, and they can undermine their sense of safety, stability, bonding, such as growing up in a home with substance use problems, mental health problems, and instability due to parental separation or incarceration of household members. So having a strong family support network for children is very, very important. However that family looks like, is them feeling like they're safe and secure in that family is key to helping to prevent some of the symptoms, some of the effects that will lead towards suicidal ideation in the future. According to the Center for Disease Control and Prevention, 61% of the U.S. adults report experience at least one type of adverse childhood experience, and 16% report experience 4 or more types of adverse childhood experience. So many of us in this room, okay, 61%, that means 2/3 of us in this room growing up experienced at least one. Now, it doesn't mean necessarily that one adverse experience affected you the rest of your life. It depends on, again, the support you had, the coping skills you were taught, and your ability to have resilience that helps to protect you from the long-term effects of these experiences. However, when you begin to have multiple experiences, it wears away at a child's resilience ability. All right, so when we think about the impact of the world on each of us, we all have internal resources to help cope with external demands. And when those external demands overwhelm our internal resources, that's when we might develop negative or unhealthy coping skills. Because when we think about behavior, all behavior is learning to cope with something. All behavior is a coping skill. Some coping skills are more effective than others. And when we look at the realm of mental health and we look at the realm of substance use disorders, we're looking at people who have developed coping skills, some of which aren't as effective as others. And so for us in the mental health and substance use disorder field, we're trying to promote more effective coping skills in those areas to reduce the impact of those childhood traumas, the childhood issues, as well as the current issues that are in people's lives that are affecting their ability to make better coping skill decisions. So the economic burden of child abuse and neglect, which is just one type of ACE in the United States, is conservatively in the hundreds of billions of dollars. Because those child neglect and abuse creates opportunities for mental health issues and substance use issues, which then all that money that those issues cause and that we have to invest into treating those illnesses and the effects of those illnesses adds up. Experiencing adversity in childhood can change the way the brain develops and functions. It contributes to increased risk of chronic disease such as diabetes, cancer, stroke, substance use, suicide, and other injury or violent outcomes. Well, if you look at those adverse childhood experiences, how could it increase chronic illness? Again, if you look at coping skills, all right, if you're not coping well, you're not eating well, you're not exercising, you're engaging in behaviors that create chronic illness. You might start smoking. You might be using alcohol and drugs to cope. All the things that people do to cope in negative ways increase the chances of chronic illness, diabetes, cancer, stroke, all those kind of things that people do that are unhealthy eating, those kind of things will lead to this stuff. So if you have those childhood experiences, adverse experiences, it reduces those coping skills to do what's best for you. Adverse childhood experiences increase the risk of overdose and suicide later in life. And so if you look at opioid use disorder involving prescription opiates, it was associated with an increase of 40 to 60% in the risk of suicidal ideation. Losing a loved one to overdose or suicide are themselves adverse childhood experiences, and that can increase the risk of suicide or overdose. Preventing exposure to adverse childhood experiences is an important step in reducing the risk for overdose and suicide and many other negative health and well-being outcomes. So again, focusing on preventing child neglect and abuse through parenting training, through providing economic resources for those families, because we know that lower economic families have more difficulties because they have much more stress. When you have much more stress, you're much more likely to end up having to neglect, because you might be working 2 or 3 jobs and leaving children at home and not being available to them. You might be without the resources, then your own coping skills as a parent may reduce, and therefore your tendency to use more harsh parenting techniques may occur. So a lot of prevention is in the realms of education and providing the kind of supports those families need to be able to not only survive, but to thrive. So effective ways to prevent all 3 issues. We want to align funding, programs, and policies to have greater impacts on those issues that we were talking about. And really looking at the prevention model is really key. Preventing these adverse childhood experiences takes all this community. It takes our government, it takes churches, it takes the public health facilities and the private sector to be able to come in and really put a focus on not hoping that one agency or another is going to be the solution, that we have to come together in ways similar to the way we're doing with the Building Brighter Days, is bringing all these people together to look at preventing suicide. We need to also make sure we're looking at ways to prevent those adverse childhood experiences where we can and how we can. Generating a greater understanding between ACEs and substance use, and how that's affected, and doing that education early with not only children, but again, bringing families involved in this process. Engage with leaders for the prevention and change in their own communities. So, it's hard for us to generate always a grassroots effort if you don't have leaders stepping in and standing up, right, to help take on some of the things that we need to do to make this prevention much more effective. And then we need to employ a comprehensive public health approach to prevent harm in the first place. Identify people at risk early and ensure equitable access to the needed programs and services. We need to provide long-term social and economic supports. So income support for working families, paid family sick leave, quality child care, access to substance use treatment, and increase in safe, stable, nurturing relationships and environments. We need to do that in a very broad perspective, in a very broad way. We need to teach coping and problem-solving skills, again, including parenting skills, social emotional learning programs to prevent or mitigate the effects of ACEs. One of the things that ACEs have on children, one of the things we're seeing with this young generation is kind of a lessening of empathy for one another. That we're not seeing the development of empathy occur in the children we're working with, children as young as 7, 8 years old, just not getting it, just not recognizing a need to care for what happens to their peers. As we see an increase in lack of some social skills, and I would dare say that there's an ACE out there that isn't on this list, and that's the amount of screen time that children are exposed to. Because the amount of screen time they have with their phones and with television and with computer games, one of the things it does is it removes them from interacting with each other to develop the social skills necessary to develop empathy and caring and the kind of social skills that will prevent those a few of those ACEs like bullying and racism and judgmental kids who are judgmental. So screen time is something that we really need to address, not only as a community, but as a nation. In fact, there was a town in Ireland, like 2 years ago, they outlawed smartphones for kids under 17. And all the parents of the community rejoiced because they couldn't do it on their own. They didn't have the gumption just to hold the phones away from their kids because, why? My child will be the only one without a phone. They'll be different. And so when they outlawed it, the parents rejoiced, the kids rebelled for 2 weeks. And then you could hear kids playing outside again in the neighborhoods. Their grades went up. Their social interactions improved. They had less behavior problems in the schools. It just had a ripple effect, and a positive ripple effect by not allowing kids under 17 to have smartphones. They still had access to computers for school and things, but limited screen time. And so that's one of the things that we really need to promote, which will help this young generation avoid the ACEs that lead them right to these unhealthy coping skills using substances and mental health issues. We're seeing high rates of anxiety in children and adolescents in our practice. How about you? Those of you who are treating kids. Lots more anxiety, lots more OCD kind of behaviors, lots more depression, I think, in the young generation. And so we need to address that as a community. Efforts may be most effective if we begin focusing policies, funding, and programs where the need is the greatest. And of course, that takes people using politics to make it work for them. And that takes those of us in the mental health field being much stronger advocates for the things that we are passionate about in promoting for prevention and in mental health care. And that means calling our state representatives and state senators and being much more proactive in just thinking that someone else is going to do it. Some lobbyist is going to do it for us. If you have opportunity, send letters, send information. You really promote behind and have an impact so that your local representatives will have an impact in the state government that can also provide more funding to help prevent and create prevention to avoid the kind of outcomes that we're having and to reduce, ultimately, even the amount of suicides. Okay, any questions or comments? Because I'm not the only expert here. Well, I think most colleges now, or a lot of them, have their own mental health providers on campuses. There may need to be an increase of that, and also working with any graduate psychology programs to begin to help train those students in what we call mental health first aid, and making the kind of peer support available on college campus might be also very effective. So if you look at, those of you who are studying psychology or in graduate programs, to be able to have some real hands-on experiences, is if those college mental health offices would provide some hands-on, like I said, mental health first aid, as well as peer support, and get that out there to the university staff, because one of the things that they mentioned earlier is how effective peer support is. College students talking to college students will be often as effective or more effective than a mental health counselor in terms of a first line of help. Yeah, it hasn't been verified data yet, or it hasn't been reached the point that they're seeing that as an ACE, and it may be just something they kind of overlook because it's taken for granted, that our kids are going to have screens. We're all texting our kids, right? And of course, everybody wants their child to have a phone at school, right? No, but a lot of people want their child to have a phone at school. What's the reason? In case there's an emergency, they can call me, right? Well, if there's an emergency and they're all trying to call you, the lines get all jammed up anyway, and it creates more confusion. Plus, a teacher has a phone if it's necessary. So, in fact, I think Florence District 1 is doing something to make phones in schools much less available, which is also important because it's distracting. And kids are playing video games instead of listening to lectures. They're using their phones in ways that are distracting. So it's good to remove them. All right, thank you for your time and attention. I appreciate that, especially after lunch.